Right, good to go. All right, so let me share my screen. So in order to find the EFA dashboard, I know last year there were some updates to CaseWorthy. I know depending on the view that you had in CaseWorthy, some people had the EFA tab on the left side where you can do an application. Others had them in a different section of CaseWorthy. So I know as of last year there were some updates. So I just quickly want to go over exactly where you can find the EFA dashboard with different views that you may have in CaseWorthy. So currently I am under the housing programs view. So just depending again on the access of CaseWorthy you have and the view that you have with the program you are working with would depend where exactly your EFA dashboard will live. So with housing programs, your EFA dashboard is going to be in the My CaseWorthy tab. Once you're in the My CaseWorthy tab, it is also that first page that opens up when you log into CaseWorthy. That's going to be located on your right side. It's going to say that's EFA dashboard right here on the right side. So this is where you're going to access that dashboard for emergency financial assistance. And this is, again, where you're going to be checking closed applications, active applications, and then also starting applications. So that's where we're located for the housing programs. When it comes to the hub, if you are working with the hub, your applications are going to be different. Yours are going to be located here on the left where it says EFA applications. This is where you'll be seeing your dashboard if you do want to, again, look at previous application, start an application, or anything EFA related. And if I'm not mistaken, with the Ryan White view, that one is also going to be located in My CaseWorthy tab right here. And then it's going to be right here on your right side where it says EFA dashboard. So essentially the housing view and then the Ryan White view, you all have it in the My CaseWorthy and then the EFA dashboard. And then with the hub, that's going to be located on the left side for you guys. All right. So coming back to the housing programs view. So again, EFA dashboard. Right, so this is going to be the first page where you're going to be seeing the EFA dashboard. Give me 1 second, sorry. All right. So this is going to be the user dashboard for EFAs. It is broken up into different sections, and which we'll be covering all of them. So quickly, just to go over, like the first page is going to be just giving you like your welcome. It's going to include your name. It kind of gives you some steps. If you do want to start an EFA, you click on the right side right here where it says start an EFA application. If you need to see any specific documents, you also have those documents in here. And then also using the My Workspace section below to manage any existing EFA applications. So first section right here is going to be the My Workspace or the EFA application in process. So if you do have any applications that you are working with, so say for example, you started an application, however you didn't complete it and you have to go back to upload any documents, this is going to be that section where it will be located since that EFA application is in process. Next section is the closed EFA application. So this is going to be more if they're going to be previous applications that you have done for clients, and it's just going to be an overall dashboard of all clients that you have done it for. So these closed EFA applications, this is where you're going to see that information in terms of the status of the application, if it was closed out, if it was approved, all that information. This is where you'll be seeing the statuses for your previous or current applications between these two workflows right here. And then moving on to the right side, you do have that EFA application, which we'll be clicking on shortly. And then again, you do have this EFA documents and forms. If you do click on these EFA documents and forms, you will be see the different document types that are needed for the applications. So for example, there is the IDPH carbon monoxide, IDPH housing plan. So all these documents are available here if you all need any clean copies. If you do need any copies, you could just go ahead and click on it. So for example, we do have this IDPH carbon monoxide alarm. If you click on the right side, it's going to say view and download, and it will give you a copy of that specific document that you are looking for. Also, I know some documents are in Spanish. The consent's not on here, but some documents are in Spanish, just depending on the type of document. Most of them are in English. However, if the client is Spanish speaking, there are some Spanish documents as well. So again, any applications or any forms that you do need for the application in here, this is where you're going to be locating that information. Right, and then moving along the quick links, there is a user guide for CaseWorthy. This is just more like a quick link, exactly like how to navigate CaseWorthy. So if you want to click on that, that's also available to you. And then also we do have the AFC forms available, which is very similar to this EFA applications. Clicking on the EFA documents and forms is going to be easier than clicking on the AFC forms, just because this is going to narrow it down to those EFA documents. And then you also have my support tickets. So if you do have to submit any support tickets or you want to see any previous ones, this is where you would be going. And then my CaseWorthy profile, this will just be taking you back to your main profile in CaseWorthy. So it's essentially going to be the EFA dashboard of where you're going to be seeing anything EFA related. So starting off, we'll do an EFA application together and then kind of go through the process of how to submit one, how to process one, so forth. So we are going to be working today with CESA Test. So that's going to be our client that we'll be using today. So with CESA Test, I do want to note that any previous client or the last client that you looked up in CaseWorthy is going to be the client that pulls in that for that EFA application when you started. So for example, since CESA Test was the last client that was looked up, that will start the application for CESA Test. So clicking on Start New EFA Application on the right side, it is going to ask us for the workflow. So this is from last year. So I'm just going to start a new workflow. Right, so it's going to ask you to verify. You're currently in the client's profile, so this is for CESA Test. Do you want to start the workflow for this client? So on here, this is where you're just going to verify if this is a client. If it is a client, just put yes, I want to use this client. Great. If it's no, then you would just have to click on no and then look up that client. So then you can look up that specific client that you want to complete the application for. So in this case, since this is for CESA Test, we're just going to confirm and click on yes, I want to use this client. And it's just going to give you like an indication here. Great, click continue the button to continue with the client. So then on the right side, just click on continue at the bottom right. And it's going to move you to the demographics for the client profile. So when you mainly log in, when you look up a client in CaseWorthy, you do get that client profile. So this is where that information is pulling in from the client demographics in the client profile part. So it's going to be 3 parts for the demographics. So first one is going to be the client profile. So we'll indicate on here the client name and the client ID. Now, if the name is different, say if there was a different name or a legal name change, or if there was a name entry error, this is where you can also correct it. So if it is a legal name change, so it's going to say check if this client's name has legally changed and if you need to update it. So you would just click on this box and then just update their legal name on here. If you, for whatever reason, maybe there was a mistake on their last name or their first name where there is a typo, you can just click on this box as well and then just correct the name as well. And then if they have any preferred names as well, you can also enter the preferred name for the client on here, and then this would update it on their profile as well. That's going to be on the client profile. If you can click either on demographics or on next. If we do click on next, it will take you to the demographics page. So on here, just going to confirm all the basic information. So the first part is going to include birthday, social security number, if they're a veteran, preferred pronouns, and primary language. Do want to note that moving throughout the training, anything that is starred is required. If it doesn't have a star, it's not required. But if it does have a star, that is a required field that does need to get filled out before moving forward with anything CaseWorthy related, whether it's an application, case notes, anything that does have a star, you just do have to answer that as a mandatory field. And then second part is going to be the identity information. So here we'll be covering gender, sex, sexuality, race, ethnicity. So again, anything that starts. So for this section here, it's just going to be required for gender and for race and ethnicity. Since this client was already in CaseWorthy, they already had a CaseWorthy profile. That's why all this information is already pulled in. It's important that you just verify that everything is correct. We do want to have the most up-to-date information for the client. So just double checking that everything is correct. And again, if any corrections are needed, please go ahead and do so during this time on this section here. So we did cover this section here for the demographics. And again, if for contact information, this would be the next section. So top one's going to be address information. So here we do have the current address, which is going to be 151 North State Street. So on this section here, if the address is incorrect, you can go ahead and click on this box. This is going to pull the most recent address that was located again in the client profile. However, if this is no longer the case and the address is different, just click on this check mark, the box right here with the check, and then look up the Google address lookup on here, and then this will allow you to look up the address, and then it would update it on the client profile. If the client is unhoused or homeless, that is another option here where you can check this box, and then it's just going to ask you in what area do you mostly spend their time at. But in this case, I'm going to leave these as usual. So we already have this address on here, 151 North State. So that's going to be the one we will be using today. Next section is going to cover the contact information. So here it's going to be the primary phone number. If it's okay to call this number, leave a voicemail, or if it's okay to text the number. And then also if the client has any email address that they would like to add in as well, this can be added on here as well. And also there is this link section right here where it's going to be adding any social media contacts. So if that is an option, if the client wants to share any social medias, you can also add that information on here as well. Next, the last part right here is going to be other system identifiers. So I know multiple clients can work in different databases or be entered in different databases. So if you do know that this client is in other systems and they do have like IDs, please add those on here if they pertain to any of these, as it will be easier just to look them up in a case where we only have their HMIS ID maybe, but not their CaseWorthy ID, or we might have their Ryan White ID. However, we don't have their CaseWorthy ID. So for example, if they are a Ryan White client and you want to add their ID on here, it's that you do. So again, if you do want to search it up a different way as a Ryan White client, then it will be easier to pull in that client profile. So if you do have any other system identifiers, please add those to this section on here. Right, so then we verify that everything is good. No changes are going to be added for here. And also note that on the left side is the workflow, so it is going to be coming down the list little by little. So we did choose a client, we did verify, now we're in the demographics section. So then if you notice, once we complete this, we covered all three tabs. If I click on save on the bottom right, it is going to take us next to this EFA enrollment, and then it'll give you the check mark that this information is completed for this section on here. Right, and then just making sure that every time that you are completing the workflow that you are completing save, just to make sure that that information is saving. We don't want you all to be starting an application or starting a process and then it's not saving. So just make sure that every step that you are taking, you are clicking on save on the bottom right. All right, with the EFA enrollment, this one is pretty much already set up automatically when you click on continue. So it is going to include the client ID, client name, the case name as well, and when the application will begin. Since we are starting the process today, that's going to be when the enrollment will technically be open for this section on here. So we do have the begin date, and then we also do have the program, which is going to be for emergency financial assistance or EFA. And then the case manager, since I am the one working on this application, it's automatically going to default me as a case manager. So whoever is the one initiating the process of the EFA or the starting the process, that's going to be the person who's going to be assigned as the case manager on here. And then the provider is also automatically going to pull in. It's going to be based off your profile. So it's going to go pull in with your agency that you are working with. If there is an EFA enrollment already in the client profile that you're trying to do, it will not let you create another EFA enrollment. So it will give you like a red flag or like an alert on the top saying that there's already an EFA enrollment existing. So then you can just pick up back into that EFA application. Again, you can go on your dashboard, see where you left off on that application, and then just resume that application. We do have it set up in that way where there is an alert because we don't want to create dual enrollments for EFAs or having multiple EFA applications. So again, if there is already one in process that's still active and open, it will give you that alert that there is that EFA application. So in this case, everything is looking good. The date's correct, everything's good. So we're just going to click on save. Right. So this is going to be the assessment part of the EFA application. So here we're going to be covering exactly like entering the financial information, HIV assessment, primary care, insurance, so forth. But before we do begin the assessment, it does ask you if you want to copy all assessment data. So if there's any previous assessments that you have done, most likely this will work more with housing, where if you did complete an assessment not that long ago, you can copy some of that information from your previous assessment. However, we do still suggest that you review the entire assessment to make sure that the information is the most up to date. For today's training, I'm going to select no, just so we can do like a clean copy like all together. So for if I want to copy all assessment data, I'm just going to select on no and click on done. And it's going to be taking me down this list again. So for example, this section is locked, so you cannot move on to the next section without completing the previous section. So right now, this is for CESAT again. So then we're going to be coming down. So right now we are in the brief HUD universal data. So here it's going to be starting off. So have you experienced any homelessness before? So in this case, just to keep it simple, we're going to say that no, we have not experienced homelessness with this client in the past. And then question is current living situation. So you do have different situations where you can select. So it's going to be homeless situation, institutional, if also there's other as well. So for this case, I'm going to select a temporary permanent housing situation. So to keep it simple, I am going to say that this is going to be rent by client with no ongoing housing subsidy. I feel like this is going to be the most common one that most folks use. At least when I was a case manager, that'll be the one that I'll use the most. So I'm going to leave it as rental by client with no ongoing housing subsidy. So that's going to be our current living situation for our client. So once this information has been answered, just at the bottom right again, click on save. And it should unlock the next field, which is going to be the health insurance assessment. So on here, it is already indicating on here that there is an active insurance on file for this specific client. Again, since I do work with this client frequently in the database, so it is going to pull in that I do have Medicaid, Blue Cross Blue Shield for this client, and insurance of when it began and that is currently active. Since this is already in the system, it's going to ask if this is still accurate. If we select yes, we're just going to move on and click on save. However, say you have to update that insurance information, you would just click on no, and it's going to ask, do you currently have health insurance? So we could either select yes or no. If you select yes, it's going to give you the option to add in that insurance information. If you select no, it's going to ask, why do you not have insurance and do you need assistance getting health insurance? I'm going to select yes. I'm going to keep it, but just want to show you all exactly like what questions are being asked when you need to enter that health insurance information. So when you click on add insurance information, it's going to take you to this page where it's going to ask more information in terms of insurance plan. So it is going to ask, for example, begin date and then the end date. If you're not sure of the begin date, you could just put the beginning of the year. If the client is unsure when that insurance policy did begin, you could just go ahead and put the beginning of the year for that current year that you are in. So for example, I'll put January 1st. I'm not going to save this just for an example. For the end date, if this is an insurance plan that is currently active, all you have to do is click on this little star and it's going to keep it as an open status for insurance at the moment. For insurance type, it is going to give you different types. So if this is Medicaid, Medicare, state children's health insurance, employer, so forth. So just selecting the one that applies to the insurance that your client does have. So in this case, we can select Medicaid. If it is Medicaid, it will ask you also for the specific plan. So if it's going to be Aetna, Blue Cross Blue Shield, County Care, Molina, so forth. So it was just going to ask you for your insurance provider. And then also here it's going to ask for the patient information. So the relation to the insured. So this is the head of household. This is the main client in charge of their own insurance. And then you can also enter the member number on here or their account number on here. Once that information is filled out, you would just click at the bottom on update, and then it will be saving that information. Again, so since information I already have it on here saved, I'm just going to cancel this one and then just go based off of the insurance information that I already do have. So for this, let me go back to yes, this is the most up-to-date information. So we're going to click on save at the bottom right. Next is going to be asking more about the primary care provider for the client. So do you have a primary care provider? If you answer yes, it's going to be asking, have you visited your primary care provider in the last 6 months? And based off what you are answering on certain questions, it's going to determine if there's going to be more questions that are going to be asked or what type of questions. So for example, if you select no, that you have not visited a primary care doctor in the past, it's going to, or if you have a primary care doctor, sorry, it's going to ask why do you not have a primary care provider. So then you do have to give a description on here as to why the client does not have a primary care provider. In this case, I am going to say yes. And once you select yes, it's going to ask, have you visited your primary care provider in the past 6 months? For this section on here, I'm going to say that the client has visited in the past 6 months. Once you select yes, that's the last question that's going to ask for this section on here. And then we could just move on and click on save. right? And then it's going to ask you about HIV assessment information. So also it is going to give you on here like any past HIV assessments that have been completed. So if there has been any other Ryan White work that has been done in this particular section for HIV assessment, it will pull in those previous assessments. However, since this client does not have any previous assessments, that's not going to show up on this section on here necessarily. So it's going to ask, have you been diagnosed with as HIV positive? So I did select yes. It's going to ask for the date of HIV diagnosis. So I did put January 1st, 2000. And have you been diagnosed as positive for AIDS? So for this one, we're going to select no. And then, do you have a Ryan White case manager? So depending on what your answer, it's going to ask more questions. So if we do ask, do you have a Ryan White case manager? If you select yes, it is going to give you the option on here to add in that case manager name. And if they've seen their case manager in the last 6 months, whoever if you select no, it's not going to answer any further questions. If you do select yes, you do have the option to go through here. So we do have the Ryan White case managers on here. So you can just go through this section right here, select the case manager that is being case managed by the client. And then you can also just include, have you seen your Ryan White case manager in the past 6 months? So then you would just select yes. For this case, I'm just going to keep it simple. I'm going to put no, that this client does not have a Ryan White case manager. So we're going to click on save. And now it's going to ask you about financial assessment, the financial assessment part of the EFA. So here, this is going to be if the client has any income, this is where you will be entering this information. If the client does have a source of income, you will keep this top section as yes. So it's income from any source, you will keep it as yes. And then you will just have to check the one that applies, the income type that applies for the client. So if the client has earned income, you will click on the earned income, click on the checkbox. And then for the amount, this is where you would enter the amount that the client is received. It does default it to monthly. So you'll just make sure that you are calculating the rate, that if this is going to be for earned income, that you do enter the monthly amount for the entire month. If your client is receiving SSI, same thing would apply, just clicking on SSI on the check mark, and then just clicking on the amount per interval and clicking on that section on here. If the client has two sources, I know there's sometimes clients that receive SSI and SSDI. You can always click on two. So you would just click on SSI, enter the amount for SSI, and then also entering the amount for SSDI. If the client doesn't have any income, in that case, what you will have to do is you will not have to check any of these. And for the income from any source here, you will just select no. And then it'll give you at the bottom here, save as no income. So you do have that option on here as well. So for this one, just to keep it simple, I'm going to just keep it as save as no income. So I'm going to leave this one as blank. All right, so we're going to click on save as no income. And then for this next section, it's going to ask you more for temporary financial crisis information. So for this section on here, it is going to ask you for the first one is, please choose the emergency or crisis situation that best fits your needs for assistance. So if you look through these options, it is going to give you different ones. So if there is any experience of loss of employment, delay or loss of benefit, public benefit, medical disability or emergency, natural disaster. So you do have multiple that you can select from. So just selecting the one that applies to the crisis that the client is going through at the moment. So in this case, I am just going to say that this is a loss of employment, just to keep it simple. And then once I select that, it is also going to ask for the reason for the assistance. So it's going to ask if it's going to be to maintain your current residence, if the client is going to move from a residence to another permanent housing, or to move from homelessness to permanent housing as well. So in this case, we are going to say that this is going to be to maintain current residence. And then next question is a crisis related to the COVID-19 pandemic? So this one, it's really, we don't use this option as much. This was more back like in 2020, 2021. Well, there's specific funding for this section here. So for this section, this is not really applicable. However, you still do have to answer it. So we are going to say this is not COVID-19 related. All right, and then the next section is going to be a narrative detailing the situation that caused the temporary crisis. So on here, this is going to be where you are going to be concise. So you have to be brief but concise at the same time to describe a little bit of what is going on with the client. So you do have to give a description, and then also in that description or that narrative, you also do have to include the amount that you are requesting. that is something that a lot of folks sometimes do forget of entering that amount. So you would just have to include what exactly is going on, and then what is it that they are requesting. And then Josh and Frank will cover a little bit more in the program section of it in terms of narrative, but just wanted to mention that briefly. So on here, I do want to put a test just to keep it simple. And then please describe how the household will be able to sustain stable housing after receiving assistance. So here, we do also want to see a narrative in terms of how the client will be keeping their housing. So we want to make sure that the client is being set up for success, so making sure like, okay, if they are going to receive the help for this month, how will they be able to sustain next month? So just including on here exactly what's going to be going on, how they're going to keep their housing, what's going to be the plan, just to make sure that they are able to sustain their housing moving forward. And then for this section here, also just going to put in as a test. And then at the bottom, it is just going to be including that signature. So client consent and signature. So you can add your signature if you don't have that signature on here, or you can use a stored signature. In this case, I already have a stored signature, and I'm just going to click on that. And then once you reviewed everything, making sure that everything was filled out, your narrative, everything is good, you're just going to click on save on the bottom right. All right, so now it took us back to this section. So again, remember we did start off by the demographics, enrollment, EFA assessment. This is just what we just completed for the assessment. So then now we're going to have to create a payment request. So exactly what it is that the client is requesting for the EFA. So for the payment type, there is different ones. So there is emergency internet, cell phone, utilities, mortgage, rent, payment, rather if it's first and last month, or eviction prevention as well. So depending on the one that you do select, is going to ask you more information in terms of the vendor and the request information. So if it is something related to utilities, it will be asking you on here for that account number, and then you would have to select the payee. So if it's going to be ComEd, People's Gas, whatever company that they are using for the utility, this is where you would have to enter it. Now, say that this is for eviction prevention, where the client received an eviction notice and that they have to leave. Then if you do click on eviction prevention, it's not going to ask you for an account number, but it will ask you what dates the payment will be covering. So 1 month it will be covering, and then at the bottom, it will be the vendor or the payee. So for example, since we are in February, I'm going to say that this is going to be eviction prevention, that this will be covering the payments of January 1st to, let's say, December 31st. So it's going to be covering that month of January for the rent. This EFA 90 days is more like an internal, so this will be more reviewed later on. So disregard this for now. So for this one, we did select January 1st and to the end of January, and then the rent amount is going to be on here, or what it is that the client is behind. So the requested amount, we are going to say that the client is behind with $1,000. We'll say that their rent is $1,000. So since it's covering this month, that's what they're going to be behind with $1,000. So once that information is filled out, you also do have to fill out the vendor and payee information. If you click on the payee name, there is a magnifying glass on here. So once you click on that, this is going to be looking up the vendor or who's going to be receiving that check if they are approved for the EFA. So if the client is approved for, let's say, utility assistance that they're behind on their light bill, those checks go out to that light company. It's not going to go necessarily to the client. So on here, then you would just have to look for comment, and then that information is going to pull in. In this case, since this is an eviction prevention, this is where you will be looking up the landlord specifically. So I do have a landlord in the system, but I do want to highlight that there is 3 different ways where you can look up to see if the landlord is already in the system. Even if the client has not worked with an EFA application before or with housing in any way, it's important that you still look up the landlord. I would always say 2 times in 2 different ways. So looking them up either by their first name and last name, and also looking up either by their EIN or their social security number. Sometimes they're already in the database, so it's just important that we're not creating duplicates on here. So it's important that you are double checking to make sure that the landlord isn't in here. So again, you can look it up by the payee name, EIN, or the social security number. If you have either the EIN or the social security number, I think it's a little bit faster to look it up that way versus typing in their name. But whatever works best for you all, that'll be great. So on here, I'm going to say that I already have says landlord. Yep, so we have says landlord on here. So it's just going to include the payee name, the address, and then the tax type as well. Now, if the landlord that you are looking for isn't in the system, what you can do is click on add new on the top right. When you click on add new, it's just going to walk you through the process of adding a new vendor. So the vendor name, so you're going to have to check for duplicates, enter that contact information, tax type, social security, or EIN. So all that information, this is where you would come in here to add in a new landlord or vendor if needed. So again, going back to the vendor, I am going to select the one that I already have in the system, which is going to be for Cesar, that's landlord. So we're going to click on this one right here. And it's already going to automatically pull in that information. So on here, we do have Cesar's landlord. We also have Cesar's address on here. You can include the phone number if you would like. I always suggest including it just in case that information is needed. However, this isn't required. And then this tax type and social security number, this automatically pulled in when I already clicked on Cesar test since he was in the database already. So all this other information was just already pre-populated because it was already in the system. So once you double check everything, making sure this is good, again, just clicking on the bottom right and clicking on save. Now it is going to ask if you want to add another payment request. If there is another payment request that you need to add, you can click on yes and click on save, and then you would process the next request. So for example, let's say that the client maybe behind $400 with the light and another $400 with the gas. Your first payment, for example, that we just went through, you would enter your ComEd one. So and then you enter that ComEd, click on the vendor, wanted to request the second part, which would be the gas for the other $400. Then in that case, you would just click on yes, totally. And then this is going to give you the option to submit that second request where you can add in that gas as well. With this one, since we are just requesting for that month that they are behind with, we are just going to select no thanks, and we are not going to add any more payments. So once you click on that, click on save. And then now it's just going to verify this information that this is going to be like the summary. So this is going to be for today. This is for eviction prevention. This is going to be the total request for $1,000, the payee, what months it will be covering, who this is getting requested by, and then the status as well. So once this information is good, you're just going to click on save again. And then it's going to take you specifically to the application overview where you can start these documents on here. So the application overview, it is going to include the applicant's name, the EFA, when the EFA was started, and who is the case manager. It is going to be in 3 sections. So application overview, applicant info, and payment request, in which we'll be going through together. Also, you do have this option on here on the right side, so request assistance. So if you do have any questions where you're struggling with the EFA, how to submit something, how to process something, you can come in here for this request help. And this is where you can submit a ticket, and this ticket will be going to the program's end. If you have any questions like, hey, I have a question, how do I enter this information, or what do I enter here? This is where you can come in and ask for help. Just note that these tickets do it comes to different people. So just depending, for example, EFA tickets, I know most go to Frank. For tickets overall with AFC, we do suggest giving at least 48 hours before responding, 2 to 3 days. It kind of just depends on the time of year as well, and the number of applications or number of things that we are experiencing. So please submit those tickets. We do try to respond as quick as possible, and if possible, that same day. So if you do want to submit any tickets or any requests, please feel free to enter those on here if you have any questions. All right, so here, if you look through it, it is going to be color coded. So there is this progress overview. So we have 1 through 5. So 1 being assessment. So we did complete that assessment portion up here. So it is marked as green as complete. Number 2 being program documents. It does say action needed. So that is why it is in red. We haven't completed the document section of it, which we'll be getting to shortly. 3 being the payment request. So this one does say complete, and it is green because we did enter exactly how much we are requesting and what months will be being covered. Step 4 will be uploading payment request documents. So it also says action needed, hence why it is red. And lastly, it's going to be document landlord document on here, and then this one does say complete, which we'll be also getting to in shortly. Great. So with this section here, we're just going to click on next. So on here already says for step 1, the program assessment. Again, this is where we enter the narrative. If you maybe notice your narrative like, oh, I forgot to enter the amount that I want to request for the client, you can always just click on edit crisis information, and it will take you back to the section on here where you can edit that information here. So this is going to be the top section for step 1. Step 2 is going to be the program documents. So here's going to be asking for the documents to complete this EFA application. So 2 of them are going to be the temporary crisis documentation and the current proof of household income or no income. So to upload these specific documents on here, what you would do is click on this program documents box right here. Once you click on it, there is going to be possibly other documents on here that were already submitted by other folks on here. So for example, we do have the verification of HIV status on here. So that one's already in the system. The issued photo ID. So these are the required documents. So we have to make sure that all of these are filled out and completed. The reason you only saw 2 documents on the first page is because these are the 2 documents that are missing. However, once you open the entire checklist, you are going to be seeing all the documents are required and which ones may be missing. So if it is blue, it's already been approved. If it is green, this one says uploaded, approval pending. And then this one that is yellow, this one is going to indicate that it's not uploaded. So when you are working the EFA application, we do want to make sure that all of these are going to be either green or blue. So again, either approved or that you did upload them and they're just approving pending approval. And with the temporary financial crisis documentation, so this is going to be support documentation to provide a crisis, so a letter of unemployment, police report, so just giving that crisis documentation. For this section here, if you want to upload, just click on the little cloud and click on browser, and it would give you that little section where you can include that document. So I'm just going to include this random form on here. We're going to click on upload and save. And as you can see, now it turned into green. So it's now saying uploaded, approval pending. And then now we are missing this other form. So it's going to be the current proof of household income or no income. And this does have to be within the last 90 days. So again, if you want to upload, you can just click on the little box right here and the little cloud, and then just upload that specific document that you want to upload. And then we're going to click on upload and save. And then again, just make sure that everything you have on here is uploaded. If you want to see the specific document that you uploaded, just click on the magnifying glass and it's going to give you a view of the specific document that you did upload. And if for whatever reason you may have uploaded the wrong document, you can just click on the X right here and then you can just re-upload the document as well. All right, so it's going to be the program document checklist. So making sure all of these are completed for here. Now that we checked that everything is green, or yeah, green, sorry. So everything is already approval pending. You just click on save. And now we did complete this step 2. So now notice that this one is marked as green. So then now what we will be doing is click on next. So then now again, step 1 is green. We went over this. Step 2, we just upload those documents. So this one is marked as green 2. And if you do want to see those documents again, just click on program documents. Moving on, it'll be 3. So this is where we enter that payment request on here. So we do have that eviction prevention. Again, it's amount. If you have to review it, you can always click on review request. If you need to click on it, if you have to make any edits, you can also edit the request. You had a typo with the numbers and edit that request from here. All right, so the information is on here, and then 4 is going to be upload payment request documentations or documents. So here, if we do click on the documents, it's also going to give you that checklist of which documents are required. On here, we are going to need the lease and also the eviction notice. So here, the current lease, so the contract between the landlord and the property manager to indicate the client is actively staying in the residence, or mortgage statement must be dated within the last 30 days. If there's any previous files, and I think this will most likely work with housing programs that the client is already enrolled in. If the client has already a lease uploaded in the system, you can always click on select right here on the little hand, and it'll give you the option of seeing previous leases that have been uploaded. So right now there is a previous file that has been uploaded. You can search that file and then you can tie it in with that specific lease on here. So for example, we do have this lease document from here. This is from last year, so you do also have that here. In this case, I'm just going to just upload a new lease on here. So if, again, similar to the other process, just clicking on this little box on the little cloud, and then you'll be able to upload that lease. So I'm going to pretend that I have that lease, upload that document, and then upload and save. Right, so then now this was marked as green, so now it does say uploaded approval pending. So then now we are just missing that notice of eviction or the landlord statement of past due rent. So then we are also going to upload that document on here as well. Okay, now that that's completed, just double check that everything is completed, everything has been uploaded. So now that these are both green, uploaded, approval pending, so these are both good. So then we'll just click on save. Right, and then now it's going to give you this section out here. So also, if you did add a new landlord, most likely step 5 is going to be marked as red. However, since I already had a landlord in the system, that's why these documents are already pulled in. However, if you do click on this landlord documents section on here, it is going to indicate which documents are required. So for example, we do have the proof of ownership, we do have the W-9, the social security number, or the EIN verification. So this is where we'll be uploading that information. However, and since I already had my landlord in the system already from previous trainings that I have done, that's why it's not asking for any of this information. However, if you did add in a new landlord, you will still be asking you for the W-9, so you would have to upload that information. Also the proof of ownership. So all this information will be requested if the landlord is new. But again, since this client or this landlord was already in the system, that's why it was marked as green right away. However, if it is new, it will be marking it as red, meaning that more information is going to be needed or documentation. And again, if you are missing anything specific, it'll just let you know on here the yellow, and then just saying to upload, and then you just click on that button to upload on the cloud, and then you should be good. Right, so now that this one's good, we're gonna exit out of this one right here. So and then here you just want to process everything, making sure everything's good so you can do the application overview. So it is going to indicate on here that the application has not been submitted yet. So it's important that even though everything is green, it does not mean that programs already received it. So it's important that you do verify on here that the application is submitted. So again, the application has not yet been submitted. Everything's green. So if you just want to double check, go through everything together. Double check all documents, everything is looking good, everything is green, the amount is correct. It will give you this section on here to submit the application. So it's going to say on here, ready to submit. So and then once you click on ready to submit and click on submit, you should be good to go. So we're going to click submit. And then it is going to be asking for your signature. So I am going to be using my first signature and then just save and submit. And now it is going to say, awesome, you've submitted the application and it is being reviewed. So then now you're good. So then this is this is basically your confirmation, like you're good to go. Like this is already on program's end. So once there's any update with an application, you will receive an email from CaseWorthy just letting you know the status of the application. So if for whatever reason, maybe you uploaded the wrong document, you will get an alert saying, hey, your EFA has been denied, missing this document. So you will get notified in your email, and then you'll just have to come back on here to re-upload that specific document that they are requesting. Now that this has submitted and is being reviewed, I'm just going to click on save. And it's just going to say that the workflow is complete, and then you're going to click on done. And it should take you back to the EFA dashboard. Should is the keyword because CaseWorthy be funny sometimes. But if it doesn't work like right now, you can just click on my CaseWorthy and then just go back to your EFA dashboard. And then you could do it that way as well. And then on here, you're also going to see now that there is going to show you your application. So there's this one right here that says For the client and then the program, this is EFA one time. When they were enrolled, so right now this application status is submitted for approval, and it is request pending, it is 1. And then also on here, now on your right side, there is a section that says My Open Applications by Status. So it's going to indicate on here, submitted for approval. So you can also see that status on there as well. I did want to show you, I just don't have it right now, but I do have a screenshot. Let me put it up, give me 1 second, sorry. So if you do have multiple applications, so for example, there could be different colors on your dashboard. So looking at this one, for example, if it is marked as yellow, that just means the application has not been submitted. So if you do want to work on that application, you would just click here on application and then continue working on that EFA. However, if it does say on hold action needed, that means that it was reviewed by programs and they got pushed back to you because either it was missing, your narrative needs to be updated, a document needs to be updated as well. So it would let you know on there and it will be back on red. So for example, if your narrative needs more description, it will be marking you that step, I forgot what step it was, if it was step 1 or 2. However, it'll be marking it under step 1 is going to be marked as red, and then it's going to give you a short description as to why or what is a holdup. So it will let you know, please add this to your narrative, or your narrative needs to be more detailed. Same thing with the document. Document is incorrect. Please upload the right document. So then you can just click on application and then just go to that section on there and then uploading that document. And I do want to note that when you do that, just because you upload a document doesn't mean like you're good to go, because now you have to resubmit the application per se. Everything that you worked on will be saving. However, since you did upload a new document or you did update your narrative, now you just have to resubmit it. So then once you click on that, you'll be good. So for example, if we want to look at this application, we'll click on application. If there was something that was red on here, let's say if it was for the program documents on here, if we go number 2 and it was saying maybe the document for the consent was wrong, it'll let you know like, hey, it was missing a date or missing the signature, please upload and resubmit. So then you would just have to upload that document and then just go all the way to the end again and then just submit application again. So just making sure when there's an update, just going in here and resubmitting to verify that that has been submitted back. So it's going to be the different statuses. And again, if it is green, that is good. If it's blue, that is great as well. But just want to notice that this is also color coded based off the status of that application. Right. So again, this is your dashboard. So and then if there's anything that's needed from your end, it will be indicated on here as well. And again, this is going to be the main EFA dashboard. So if you want to submit anything, it will be in this section on here. And again, if you do have any questions regarding EFA requests or support, this is where you can submit it. So you can click either at my support tickets and it'll take you to that of those tickets on here that you have seen before. If you need to submit a new request, you can just click on request support here on the left side and then just on programs and just select an EFA. If it's maybe a system error, you can click on TA. If it's something where like it's flagging you where like, hey, it's already there, but it's not pulling in, you can do a request as TA. Those will go to me. And if you select program assistance, so if you have any questions, for example, maybe a check or anything EFA related, this is where you can click on program assistance and these program support EFA, these will go directly to programs. So in this case, these tickets will go to Frank. And then on here, if you are submitting a ticket, we do ask that you are as descriptive as possible. If you have screenshots, also include those, as those are very helpful because sometimes we're trying to figure out like where in the workflow you may be getting stuck or what may be missing. So if there's anything where you're receiving an error message, also include those on here as well, just so we can provide the best guidance and be as quick as possible to reply to you guys. That's going to be your ticket. And again, if you do submit a ticket and sometimes we may ask for more information like, hey, can you please elaborate a little bit more on this? In that case, if you do have to respond back to our ticket, you can just click on my support tickets right here. And that ticket that you did submit will show up on here. And then you could just click on the magnifying glass and just update information like, all right, here is information that you are requesting or the update that is being asked for. So it's going to be the ticket process for any tickets that you would like to submit. And again, this is your EFA dashboard. So past and previous applications. This is where you will start your EFA application. documents as well. This is where you would find them, and any quick links are on here as well. So that's basically the first part of the training. Josh, Frank, anything that I may be missing before I turn it over to you guys?
No, Cesar, that was super helpful. And thank you for going over the ticket as we realize, it's sometimes kind of a convoluted process to get a hold of us. So that was really helpful.
Yep.
Perfect. Well, thank you guys. Any questions before we get to the second part of the training, which will be the program overview? Any questions on navigating the workflows in CaseWorthy? All right. Well, if you have any questions, feel free to submit any tickets as mentioned, and then I will respond as quick as possible. But with that, I'll pass it over to you, Josh, for the second part of the training.
Awesome. Thank you, Cesar. Do people feel like they need a little break, or should we go ahead and get started? Otherwise, we can maybe start at like 10 o'clock. Just give people a little bit of downtime, grab some coffee. I will go ahead and pull up my presentation here.
I just want to say, Josh, Cesar, you did a great job. That was a very great presentation. Thank you so much. It was very thorough.
Yeah, you hit all of the points that cause a lot of confusion. So that'll
Great.
pair nicely with ours.
Thank you, guys. I appreciate that. And this is the first DFA training that I'm doing too. So
Oh, wow. Great
I
job.
appreciate that.
Yeah, seriously. All right, it looks like Dimitri is saying they're taking a quick break. So let's get started at 10. And hopefully feel free to interrupt us as we're presenting so that it can be interactive and we can kind of answer your questions in real time. So we'll get started in about 2 minutes. Frank, Cesar, can you see my screen?
Yeah.
Okay.
Yeah, sure.
My Teams has been really acting up lately, so just let me know if it's glitching or if you can't hear me. All right, let's go ahead and get started. And as I was saying, the more interactive this training is, I think the more meaningful it will be for you. So feel free to jump in at any point with any questions. I'll introduce the first portion of our training, and then Frank will take the second half. And Frank will moderate while I'm talking, and I'll moderate while Frank's talking. So we're happy to kind of interrupt anything we're doing so that we can answer any questions you have. This is intended to be kind of a 101 training for new housing techs and case managers. Cesar did an awesome job walking through the CaseWorthy process, and then we're going to walk through and go over some of the documentation and kind of the nuances that we see that help make the EFA application process smoother and more successful for you. Based on the names I'm seeing in today's training, I've interacted with some of you before, so I know this isn't probably your first EFA training or application. And if that's the case, feel free to jump in, stick around at the end if you need help troubleshooting a specific application. We also realize the process has changed quite a bit in the last year. There's a lot of new requirements by IDPH, new documents. And so we really appreciate your patience and grace as we navigate our funders' requirements. And then we have to kind of send that information out to case managers and housing techs at our partner orgs. So we really appreciate your partnership and collaboration on a very evolving process. And also as we navigate kind of this landscape that we're in right now politically with funding, we never know kind of what's coming up. And so we'll try to make that clear as things change. So yeah, we'll go ahead and get started. The second half is meant to be a programmatic overview. So we won't go into super specifics or nuances that you might see on one application, but that doesn't mean you can't reach out and ask questions as we're going through this training. As I mentioned before, my name is Josh. I'm the Senior Manager of Housing Stabilization at AFC, and I work with, as I mentioned, the EFA guru. I call him, technically, he is our Support Services Manager, Frank De La Mora, and we work together to help process the EFA applications that come in throughout the year to make sure that your clients who are already in crisis get paid, get their rent or utilities or mortgages paid as quickly as possible. So prior to coming to AFC, I worked at TPAN. Did someone have a question, Frank? All right, I'll just keep going.
No question.
Okay, I can't see the chat, so just let me know if anything comes in. Prior to working at AFC, I worked at TPAN as both a medical case manager and also a housing tech. So I understand some of the convoluted nature of some of our processes. So Frank and I, our whole goal is to be as helpful, as clear as possible, assistance to your client. Process is already responding to crisis. And so we know that your clients are often, about to have their utilities disconnected or their landlords, writing them for maybe a 5-day notice for eviction. Deposit an ACH. So our whole goal
Support Services here at AFC. I've been with AFC for 13 years, and prior to that, I was a navigator for Heartland, Vital Bridges, Heartland, Pilsen Wellness Center, and Chicago House. So I used to have to submit these applications as well, and get pushback on times I did them wrong or documentation was not accurate or current. So I understand completely the need for our clients' assistance, especially I know, and Josh knows as well, that the clients are already in crisis when we receive these applications. Josh said they can potentially be disconnected. A lot of times they already are disconnected. So we completely understand. And Cesar did a great job of showing you like to create these tickets. It's really important that for these tickets, whenever there's a question, there is no wrong question. Just make sure you select EFA and program assistance, and it'll come to us. And if we have to reroute it to data services, that's fine. But yeah, we're just here to help, and we really want our goal is to approve every application that comes through. So help us help you.
Awesome. Thank you, Frank. And yeah, Frank, that's a good reminder. Here's our contact information. I think in the housing side of things at AFC, we realize on the care side, they utilize JIT bits and other communication means, but we typically do best through the ticketing system in CaseWorthy so that we can track and resolve the issue. Also, Cesar and his team, the quality management team, utilize that same avenue to answer and resolve issues. And so here's our contact information if for some reason you need to get a hold of us directly, and we'll send this information out, this presentation through Cesar and the team. So no need to screenshot or anything like that. Our main goal today is to introduce us so that you know who you're working with, and so we know who we're working with. We'll quickly review kind of what the 2025 service cycle looked like, and then we'll give an overview of the EFA application process as we realize it can be a little bit confusing, just to help streamline it a bit and also show where some of the bottlenecks and pain points are for both case managers and housing techs, and then on our end. Our goal is to get an EFA application in and paid out that same week. And so any delays, both delay the assistance that goes to the client, but then also can be really frustrating for you as we're working on a workflow with check runs every week with both the rental payment processing team and the EFA team. You by no means need to know this or really understand this graphic, other than I wanted to show this so that you see where we fit in with the CHH team at AFC. So Pete Tepfer is our executive director. My supervisor is Rosa Martinez Colon, who is the VP of CHH Housing Strategy. And then I work with Frank directly on the EFA program. And then many of you probably also work with our rental payment processing team. So we have a new manager of housing stabilization, Sky, who is over all of our housing coordinators. So you may work with our HOPWA HUD COC coordinators, who are Jen Hope, Eric Maciel, and Sam Knotts. Or you may have worked with our flexible housing pool coordinators, who are Phyllis Koprick and Nicole Arroyo. So this is our whole team. We send out roughly just over $2 million a month in subsidies, EFA payments for mortgages, utilities, rental, eviction prevention. And so it's a small but super mighty team that works really closely with finance, data services, and our housing programs at AFC. So this may be clear as mud when you're looking at it, but hopefully it gives you a sense of kind of what team you're working with when you're submitting either an EFA or working with the rental payment processing team. So basically, as we were saying, Frank is really the front door of the EFA process. He's the one that's approving supportive documentation, making minor adjustments, reaching out to you for clarification. He'll reach out to you if something's submitted in the wrong format. We also have new requirements, right? So we have a carbon monoxide form that's new, a housing care plan, and the one that's causing a lot of confusion more recently that Frank's doing an amazing job clarifying on is the HOPWA income worksheet. So we can talk a little bit more about that when we get to Frank's portion later on. My role is really to complete the application process, so the approval process, choose the funding source that best fits that application, and then do a quality assurance overview of the applications. We are part of a pretty rigorous auditing process every year, both from our funders and at AFC internally. And so please know that if we ever come across as, that we're denying an application or pushing back documentation for more specifics, it's not because we're trying to be, because if we get audited and that application fails the audit, we could actually lose access to that entire funding source, right? And we have 6 main funding sources that we utilize for EFA and RPP. And so it becomes a really big deal if we can't prove that this client is in crisis, or show their income, or show their lease, or show the rights and responsibilities forms and the participation agreements. And so that's why we reach out for those to be clarified and updated. We also work really closely with the finance team. We're kind of a finance housing hybrid team because of the weekly check runs and all the different reissues and 1099s that go out for our landlords for tax purposes. And so we work really closely with them on a weekly basis. And then we also work closely with data services and the QM team to coordinate trainings, troubleshoot workflows, and then provide the technical assistance like Cesar was talking about with the request support feature as needed. The other huge critical component of success in the EFA process is you, right? You're the service provider that knows your client really well and what their needs are. Oftentimes, in an application, it's kind of unclear where the priority is. Sometimes we'll get a narrative that's not clear, or we have limitations on how we can help the client. So Frank might reach out to you and say, hey, it looks like, you're asking for ComEd and People's Gas support here, or People's Gas assistance and rent assistance. And so please, check in with your client so that we can prioritize their needs, right? Because you and the client know best what's happening in their life for that crisis situation. The other piece is that you can advocate for your clients, right? We're really limited with funding lately, and so we've had to stop the 90-day assistance. We used to be able to help multiple times over the course of 3 months, and really that is no longer an option, and we'll communicate out if that ever becomes available again. But despite that limitation, we really encourage you to advocate on behalf of your client. Just reach out to Frank and say, hey, this is what the client is going through. Please prioritize this, this request, and we can definitely look into that for you. Here's an overview of last year. EFA is really a small but mighty program. We assisted almost 900 clients last year with utility assistance, foreclosure prevention, first and last month's rent, and then emergency rental assistance. And basically, we paid out over $750,000 just in EFA last year across 6 different funding sources. And so, it seems one application at a time, it seems like we're not, helping as much as we would love to. And then we look back and realize like this is a huge assistance. And so because of our limitations, you're welcome to reach out to Frank or me, but Frank will often, share other possible resources like LAHEAP and some of the other utility assistance resources, because EFA is not meant to be a long-term, possibility. It's meant to be a one-time assistance program. Really, it's, as I was just describing it, EFA is meant to be a temporary financial assistance program. So it may be due to loss of income or some type of crisis, but it's meant to be short term. So I'm not going to read through all of this, but it's meant to be one short-term assistance per year at most for the entire household. So sometimes we'll get questions, and quite often we'll see applications by 2 different roommates on the same lease or 2 different people in the same household. And unfortunately, EFA is meant to assist with that one household. So if one roommate applies for EFA and we approve it, we will deny the other application, right? Because it's all under the same household. And so that way we're able to assist as many clients as possible. I'll stop there real quickly just to see, Frank, are there any questions, or if anybody wants to come off mute just to ask about any of the general things that we've covered so far?
Yeah, no questions in the chat.
Okay, sounds good. We got a quiet group today. Just means they're absorbing it all, and I'll have a lot of questions at the end. These are the main things covered by EFA in terms of expenses. So past due rent. We have limited funding, but through CDPH, we do have one source that we're able to use for mortgage assistance. And then oftentimes we'll see the first and last month, which is what we formally can classify security deposits or administrative and move-in fees. So we cannot cover late fees through EFA, but we can cover, like oftentimes you'll see administrative keys, move-in fees. So that can be covered by EFA. We can also cover utility assistance in the suburbs. Often that includes water and garbage disposal in some of our collar counties. In Cook County, it's typically gas and electric, People's Gas, NICOR, ComEd. We realize rates have really gone up, and we're seeing quite an uptick in utility applications. Usually we see it right around now for winter, right? Because it's been super cold and people have really high utility bills. And then we see it again at the end of summer when people have really utilized AC all summer and then realize, just how expensive it's been. And so we typically see 2 influxes for utilities: rental assistance and mortgage assistance, and first and last month's rent we tend to see year round. And then we used to cover cell phones. Unfortunately, that funding is no longer available. So I've left that in the presentation, hoping we eventually get that back. I know the case management team, care team does provide some cell phone assistance. So you can look into that through them if you have a client that's also receiving medical or non-medical case management through the care side of the house at AFC. Some of the main crises that we see for and that are eligible for EFA are loss of employment. I'm not going to read through every single thing, but here it shows you kind of the evidence that you're able to provide to show that the client is in an eligible crisis for EFA. So loss of employment, so documentation around that, a medical disability or emergency, so some type of bill from the hospital or from their provider, a loss in public benefit. That's been a big one lately. We realized the shutdown, the multiple government shutdowns that we've been seeing have really changed some of the things that we part activity all these mentioned reports and these network, a lot of you can get from or service providers moving. Um, these explanations can also as to why and then how they're going to remove the barriers to stability so that EFA is not needed in the future. So proof of these are good. We also, EFA is often used to assist clients that are in one of some the pro for the personal use subsidy contracts as proof of the crisis. Increase case. You can use that to show that the new apartment is more affordable. So that's another process that you can in there. Over a lot of people kind of misunderstand in general. The most with eviction or foreclosure prevention is $1,000. And when we're audited, we're kept to these standards. For first and last, and it's because we roughly it'll and next month. The ninth EFA an emergency response. So we do a calculation. Frank does a calculation based on 90 days on the most recent balance. So a lot of times a client will turn in, they owe $800 to ComEd, but the most recent charges are only $90, right? And so so they've had a total accumulating for a really long time, and so the calculation is based on the most recent balance. And Frank can go into more details around that. Get assistance with all of it. Utility, the as you have available. And so you'll see sometimes if there's been a disconnection notice, we are able to use that as evidence for immediate need and increase the limit up to $1,000. We can also split those caps for utilities over multiple utilities, right? So if you turn in bills for both ComEd and NICOR, that is what I was speaking to earlier, where if you can let Frank know or put in the narrative, this client has $1,200 worth of balances, please split between the two utilities. Or you could say, the client's People's Gas is about to be disconnected, please prioritize that and put any remaining available funds towards the ComEd bill. And that just makes it a lot more clear for both us and also to the client, right? I think you're the ones working directly with the client and you see the crisis and the urgency of the situation. But one thing to remember about EFA is that it's never promised. And we say that just because there are times where clients will apply for EFA and they just received EFA 6 months ago, or they're applying for mortgage assistance and we happen to be out of it at that time, and then we have to deny the application. And so that helps set expectations for both you as the provider and also for your client, just to be realistic and say, hey, our goal is to approve this, but it's not promised. And in the same vein, our goal is to approve it as quickly as possible so that you can receive that final approval email coming from me that says, it'll be going out with this. And oftentimes you can forward that to the client or the landlord just to show that the money is coming. And oftentimes that is even enough to slow down the eviction process if it's an eviction notice. All right, I'll go ahead and stop there. I realize I covered a lot of material, but also it was kind of a general overview. Most of it's probably stuff you already know from prior trainings or applications, but just want to stop and see if there's any questions before we move forward.
Nothing in the chat, Josh.
Nothing in the chat. Okay. Well, Frank, I'll let you go ahead and take over. Just tell me when the forward slides and I'll watch the chat for you.
Okay, so we can go to 13, right? We're going to skip 12.
Yeah, we'll skip 12. There you go.
Okay. Hi, everyone. Again, thank you for all being here, and thank you, Josh and Cesar. We're going to go over the eligibility criteria, and I'm not going to read this all the way through, but basically, the client has to have a temporary financial crisis that's outside of their control. So, for an example, a really quick example, if a client went and blew their, red money at the casino, that's not a crisis out of their control, obviously. But if something happens outside of their control, then that's would qualify for an eligible crisis. The client must have, an HIV positive diagnosis. And the household must have either be in imminent danger of eviction or foreclosure or homelessness or be homeless. And the client must be able to document, that's part of the narrative process, is they have to be able to not only document the crisis, but also to document how they're going to be able to maintain housing stability moving forward. You can go to the next slide, Josh. And for the counties that EFA can assist in, they are Cook, DeKalb, DuPage, Grundy, Kane, Kendall. Lake, we have limited funding, McHenry and Will. Other counties that are out there, they a lot of times have their own funding as well. So this is the funding that's available via our funding sources. You can go next slide, Josh. So basically here, this is the application approval process. When it all pops up here, let's see, but basically this is going to show like the process and the flow of the whole EFA approval process. So first, the service provider, you would meet with the client just to assess that they have an eligible crisis. And are we skipping this, Josh? But anyway, you would have to prove if they have a crisis, also gather the documentation needed for the crisis. And this is a really crucial part. I would think it's the most crucial is that when you're gathering these documents, that's where you need to find out, if they actually have a crisis or the documentation to prove that crisis. And sometimes that's tough. Sometimes clients don't have things. And for like Josh stated earlier, there's some cases where a client may be homeless, but they don't have a documentation showing that from a shelter. That's where you would create a verification letter, crisis verification letter, just stating that the client is indeed moving from homelessness. That could also be used for most of the crisis that the clients will have, but don't have documentation. You could say that they were fired from their job, but they didn't get unemployment, so they don't have an unemployment letter, et cetera. Um, so you meet with them, you complete the application, then next is you submit the application through CaseWorthy and upload all the documents that SSR showed everyone. And then the EFA team, Josh and myself, will review it. Hopefully everything's fine. If not, I will, send an email via CaseWorthy just stating what is needed to move the application forward. And again, I hate doing that, obviously, but I just know that without the correct documentation, it's not going to move forward and pass for our funder restrictions and guidelines. Once it does pass that and it's moved forward, um, we will inform you that the application is approved. Josh sends out those emails, and then that the final approval and the quality assurance part of it is done by Josh. And then he'll send out the email just stating that what check date that the check is going to be going out on. And we do check runs every week, expedited check runs and a large check run once a month, but we do check runs for EFA every week. And so that day is Thursday. So Monday to Tuesday is really crucial because Tuesday is the cutoff for when these applications should be submitted, approved, and move forward for a Thursday check date. If not, it'll be going to the next week's check run. And
Frank, I was just going to jump in and say a lot of people are tempted when they receive either that initial email that says your documentation has been approved or we're pushing it back for an additional edit or update, or the final approval email coming from me. A lot of people want to reply to that. It's really tempting to. At the bottom of that email, it says, please do not reply to this because those flood our inbox, our CHH email inbox. And so if you have questions, go ahead and submit a ticket and Frank will get it right away and he'll see what your question is. But if you reply to that email and just ask a question, it gets buried in our inbox with all the auto replies, and we often don't see it for a really long time. And so I just have gotten a lot of those in the last month and want people to know that the quickest route to get a hold of us is through CaseWorthy. Also, you can always hit, Frank up via Teams if you have like a specific question and want to jump on a call about TA or something like that. Frank's really accessible, so that's another option.
Thanks, Josh. That's a good point. And there's someone has their hand up.
Oh, okay.
Go ahead. You can come off mute.
Yeah, Jaquel.
Good morning, everyone. I do have a question. Some of the issues that my staff has with working with EFA, and I know that there's been like some new, I know we just did the walkthrough with Mr. Lopez, but some of the issues is that some of the clients do already have an income, and they are either assuming that we're just going to pay for utilities or pay for, they wait till the bill get extremely high and they want us to, to submit on their behalf, but many of them have income already. Is there something that would be denied, or something that we should be educating on our end to our clients so that we can try to prevent large bills?
Yeah, that's a
Frank,
good question. Go ahead,
yeah, do
Josh.
you want to talk about income and kind of the requirements and maybe the AMI?
Well, yeah. One thing I was going to say though, from the question was that having income is not a problem. It's more about having an eligible crisis. But it's very rare that I see a high income that will put a client outside of EFA assistance. I believe we do 80% of AMI, and that would be if it's one person, let's just say one person in one bedroom, no children, that would be I would be somewhere around 63,000, I believe. So it's very rare that we see someone's income put them out. I have done that a couple times this past year, so it does happen. But it's more about having an eligible crisis. Like, we do see clients that you're right. I used to have them on my caseload too. Every year they would try to be like, okay, it's the end of winter, so I'm going to have EFA pay my, utilities. And something we've done with that as well is that if a client is a constant user of EFA for utilities and even rent sometimes, we'll approve it one more time and then they won't be eligible for the next 2 years to receive EFA funding assistance. So, but again, it's more about them have eligible crisis. And like I said earlier, they might not. That's why that first initial meeting or phone call is to determine if they have a crisis. And many times I want to approve everybody, but there were many times where I would have to say, you don't have a crisis, and the crisis has to have happened. It can't be one that they're trying to prevent. These are crisis-based dollars, so they have to already have a crisis occurred for us to be able to assist them. Does that help?
It does, because like we just had like two clients send us their utility bill,
Hmm.
but it doesn't say anything like, oh, you're going to be disconnected, things of that
Right,
nature. It's just they're sending us their bill. They're saying they need to have their bill paid. So I just want to kind of
right,
get more clarity as to when my staff is submitting, are we just, I don't want us to be submitting because I know they only get it once a year, but I
right.
don't want to build a habit of them, oh, AFC is going to take care of it.
Right.
How can we be proactive is more so, because just having utility bill, but it's not saying that you're going to have a
That's not a
disconnection.
crisis. Having a bill is not
Exactly.
a crisis. You have to, something has to have happened to cause them to not pay their bill.
Correct.
And when I was a navigator, I used to, we used to do quarterly assessments, and we used to look at their bills every quarter, and that was part of my job to go through and be like, hey, you're spending your money on this, but it's you need to spend it on your utilities and rent first. So like I think some guidance as far as like what's the utmost important for them to pay first, which is rent, utilities, and food, of course, and anything else that they're spending it on that's, I would dare say, a luxury item, that has to come down the list, but they have to pay their utilities and rent first. And if a crisis occurs, then obviously that's what EFA is for, but they have to have a crisis.
Yeah, I
Thank
think
you.
this is a reminder too. Having been a case manager and worked in housing, I think financial literacy is really, really like critical but missing from a lot of programs. And then also we're living in really expensive times. We realize clients are living on really tight budgets with Social
Yeah.
Security, disability. And so some of it I think is a conversation around setting up payment plans with utilities so that, utilities don't spike in the winter or summer, but that
Hmm.
it's more of a constant payment that they're required to pay. Also talking with them about other resources like LAHEAP and other utility assistance. And then, as Frank was saying, if they've had hospitalization or loss of a partner or domestic violence or mental health crisis, just include that documentation, and that is a crisis, right? And so
Yep.
I think it's having a conversation with clients that when they're doing well to try to do as best as they can with keeping up with their payments, but then also not hesitating if they are in crisis to go ahead and apply for EFA, knowing that there are caps. So if they owe $4,000 to People's Gas, we're not going to be able to pay all of that for them. But, having some of it paid for will hopefully even, get the disconnection notice, rectified and get them back on track. So hopefully, Jaquela, okay, I see your comment in the chat. So hopefully we're meant to be a resource. I think it becomes a hard time when we're the only resource, right? Because we just can't provide all of the assistance that clients are often asking for.
Mm-hmm. Thanks, Josh.
Sure.
And going right here, that leads us right here to the crisis narrative. You want to have a good, strong narrative, and it doesn't need to be, a super long paragraph. It just needs to simply state what support is needed, what is the issue the client is facing, and how the issue prevented them from paying their rent, mortgage, utilities. And one thing also is that way I see is a lot of clients that are in subsidized housing, they don't mention that in a narrative, and that's a big part of the crisis. If the client is in subsidized housing, then right away their crisis is obtain, maintain subsidized housing, no matter what the issue is, because we do not want a client to lose their subsidy. So, but a good example of a narrative is the client is requesting 800 rental assistance. One key thing right there is make sure to always include a dollar amount in your narrative. It will get pushed back, and that's because for the longest time we used to see narratives just saying client needs utilities paid, and that is not enough information. That states nothing about the crisis, what happened, and what the client's going to do to moving forward to maintain their housing stability and utilities. So this right here, the client is requesting 800 in rental assistance. The client lost employment in April and was not eligible for unemployment. As a result, the client was unemployed for 2 months, which prevented them from paying their rent. That's a perfect narrative. The stability narrative, that's the next portion of the crisis information section. You want to state what the client is going to do to regain financial balance and how they will maintain their housing after receiving support. A good example, the client is actively looking for employment and completed 4 interviews over the last month. The client hopes to secure a job by the end of the month to maintain the unit. Very simple. And one of the documents that we have where this is also going to be what you put in one of the documents we have you uploading. It can mirror this completely. Just the final section on that document. We don't have it on here, but when you upload that document, the bottom section, you can just put NA if there's no barriers when it comes to housing, because we do upload that for billing every month. You can go to the next one, Josh. Wow, this is small.
Oh, sorry.
That's okay. I just didn't have my glasses on. But this is basically what you will receive when you get the approval letter from Josh. And I think this one is 90 day, but we're not doing 90 days. But it'll basically say the amount that's approved. If it was, let's just say if it was first and last month, it would be 2,000 if that's because that's the cap. I would have the payee right here who it's going to and the service dates of what it's covering. So for example, January 1st through I believe it's February 15th, and then the check date, and that would be, if this was 90 day, it would be the first payment of that. But since we're not doing 90 day, it would just give the payment number 1, the check date, the service dates, the payee, the amounts, and what the service is for. You receive that, and that gives you all the information of what and where and when this check is going out and how much.
And we specifically send these from our Housing for Health emails so that if you need to forward it or screenshot it for a landlord or a client, you won't be giving away any of their PII, PHI, right? It doesn't say why they're receiving this assistance. It just, oftentimes it'll really calm down a landlord who's about to evict a client or wondering why they didn't receive, move-in fee on time or things like that. So we recognize that a lot of the communication is forwarded. So that's why we'll send it from our Housing for Health email rather than our AIDS Foundation email.
Thanks, Josh. You can go to next screen. So this is a payment guideline for the check distribution process. I'm just going to read these off because this is good information to know. Um, the payments will never be made to the client. It's always been the case, or the household. They will go to either the landlord to pay the landlord or the utility company. Um, the client or households may not be reimbursed for any payments they've already made. We don't do that. EFA doesn't cover that. Um, the distribution checks will be limited only to, like, if someone wants to pick them up, they would be limited to you, the service provider, and you can then go and coordinate with the landlord if they want to pick it up from you. If not, it's going to be mailed from AFC, or it can be mailed also either regular air mail or priority mail. Um, the checks will be mailed unless service provider coordinate a pickup, and that is on Thursday, and that ends at noon. So I always would say not 9:30 till noon. That's the window I would give when if I was doing a check run that day, if I was in the office. And if the checks aren't picked up by you, the service provider, it'll be mailed at the end of the day. And that would be standard mail unless we were told otherwise. Sometimes things happen. Um, the checks can be retained, and if they are retained, there's it's limited to our office hours for when they can be picked up from you at a different time. Uh, these rental checks, they'll always be mailed to the address on the W-9. So when you're completing these applications, you want to make sure that that's the exact address that the landlord wants this check to go to, because the W-9 and EIN, it's crucial, of course, like when we're approving it, that they match, right? But you want to make sure, a lot of times these companies have addresses in New Jersey or another state, and the check will get mailed there because that's what's on the W-9, but they have a different address they want it to be sent to. All that needs to be, correct. And because a lot of times we'll see when we'll get messages, or tickets stating that the check didn't arrive, and the landlord's thinking that's going to some office in Chicago, but the W-9 provided had a New York office address, and that's where it goes. So wherever it is on a W-9, just know that's where we're going to mail it to. And checks, if they are to be reissued, if they do get lost in the mail, we wait 45 days per our guidelines from finance.
Couple of notes I just wanted to add, Frank, are lately we've been getting a lot of partner organizations actually sending property managers or landlords to the AFC office. And we would really request that not happen for multiple reasons. Obviously, it's a privacy issue. Because of our name, it gives away some of the reason why the client is receiving assistance. And then also it's a safety issue. We obviously have some wonderful landlords, but we also have some landlords that are understandably a little bit irate because they haven't received rent or a move-in fee on time, and we're trying to get that to them. But our team does not work directly with landlords, so we would ask that you coordinate with Frank via ticket. And what we do is put on the distribution sheet, this case manager is coming on Thursday. Please notify them when the check is ready, or this one needs to go out via priority mail because it's already late, and then we'll send it out that day on a Thursday, knowing it should get to that landlord by Friday or Saturday.
Yep.
One other issue we're seeing a lot of is that the USPS is really unreliable lately. So a lot of our checks, especially for rental assistance, will go out the month before for subsidies because we realize sometimes it takes 2 weeks to arrive. And so we have about 110 landlords right now that are receiving direct deposit ACH payments. And we've had a lot of trouble with that process, so we're initiating the second phase. So we have about 60 landlords. I know some of you have reached out about switching landlords who have unreliable delivery over to ACH direct deposit, and we have about 60 landlords in the queue that once we're able to restart that process, we'll be signing them up for. So hopefully that answers questions around direct deposit, mail delivery, and case manager pickup.
Thanks so much, Josh.
Sure.
Next slide, please. Now, this is IDPH eligibility assessment requirement for case managers with access to provide system. This is probably the first thing I look at when I'm reviewing an app, and me and Josh have our own internal spread, is I need to find out and provide. So I look all these up, every client that comes in, I look them up and provide and make sure they have a current eligibility assessment, an EA, and a current housing care plan. Um, the housing care plan will also, that's one of the forms that will be uploaded um, as part of the documentation process when you're doing your application in CaseWorthy. But they need to have this provide the EA and housing care plan. It's required for all IDPH clients. Um, the next one is AFC is unable to bill for EFA services without that eligibility assessment. So that needs to be in there. And if it doesn't right away, I like flag it, and me and Josh, have it on our spread that's missing. The EFA applications for IDPH clients will be placed on hold until the EAs are completed and provide. That's something that unfortunately that we have to push back on, because if they don't have an EA, for IDPH billing, it needs to have that, and we'll push back on it if it doesn't. Service providers are encouraged to ensure EAs are renewed annually to prevent service interruptions. Yeah, it's very important to keep these EAs current. One thing that's new here that we added right before this training was that the HOPWA rental calculation form. Some of you have already filled that out. We could do really a whole training outside of this on that one. And what I've been doing, honestly, if anyone has a problem filling out that form, just send me a ticket. And I've literally been walking service providers through it on a Teams call and just helping them do it for their EFA that they're about to submit. So, and then they keep that as their guide. And, I've been seeing a lot of progress with that as well. But that hopper rental calculation is new, that form. And as of I believe November last year, or October. And it's just something that's required moving forward for the foreseeable future. But if anyone has any problems with that, it can be a little intimidating at first, but it's pretty simple once you get used to it. And I can help you if you just create a ticket, and I'll be more than happy to walk you through it. This is the form I was talking about earlier, the IDPH form that mirrors the narrative in CaseWorthy. It really can be word for word the same thing. The top box would be your crisis narrative, and the second box would be how the clients can maintain housing stability moving forward. The bottom box needs to have any barriers that arise when you were completing the EFA or to any other resources. And if not, then you could just put an NA, not applicable, and it has to be signed by the client and a case manager. You can go next slide, Josh. Did you want to go over this, Josh, this EFA thing, or just open it up to questions?
Yeah, maybe since it's already 10:50, we can just dedicate the last 10 minutes to any questions. Looks like Jacob was asking a bit about scheduling an offline meeting. So you want to go over maybe the best way to get a hold of you around the HOPWA income worksheet?
Yeah. Just create a ticket in CaseWorthy, Jacob. And here, I had something pulled up. Let me see if I could.
Yeah, I'll stop sharing here and you can pull up.
Yeah, I'm going to share my screen really quick.
I was just going to say, because I think that's one of the pages that a lot of my staff get a lot of pushback from. So I just want to ensure that, we're definitely all on the same page with that. And with the IDPH, I know that's a new form as well. So just ensuring that they have that all together, but that's self-explanatory. I think the main one is that the calculations form, because
yeah, you're definitely not
been
alone.
Expressed.
Yeah. So IDPH added 3 forms. The 2 that are pretty self-explanatory are the carbon monoxide and that housing care plan one, because really they're intuitive and you can, as Frank was saying, just copy and paste from the narrative and stability statement into that. The HOPWA income worksheet calculation, the first tab, for some reason, we met with IDPH recently and even had our VPs try to like advocate for not including that for EFA because it's really intended for housing subsidies, like continual assistance. And so it's this barrier to one-time assistance, but they are insisting that it's required for auditors. And so Frank has put together a really good recording around, it's like a 15, 20-minute recording around that worksheet that they literally could play and fill out as they're playing it. But we also realize like it can cause a lot of confusion and disruption if they're trying to fill it out while they're meeting with the client. So I'll let Frank take over and just kind of explain the best way to get a hold of him for specific help on that one worksheet.
Yeah, and again, I've been doing. Thanks so much, Josh. I've been doing so much of those. I was telling Josh recently that it's just like pretty much every day. It feels like I'm just going through that with a case manager, service provider, just walking them through the process. And I was walked through the process as well, so I understand the confusion. And we had a jump on a training really quick just to share with everyone. If you do have any questions, either with regarding that form or any EFA related question, when you create the ticket, just make sure you go to AFC CHH Emergency Financial Assistance as the program. You're going to want to select, for me and Josh, you're going to want to select Request Program Assistance and put your topic, your subject here, and then just fill out, really clearly what exactly you need assistance with. You could put in here that, for instance, Jaquel, just put you want to schedule time for a training for that form, and then I'll get back to you and set up a date where we can go over it on Teams, and then I'll help you, get a better grasp of it. Trust me, a lot of people have been requesting that, and I am more than happy to help.
I appreciate that. Thank you so much.
No
Jaquel,
problem.
would it be helpful too, Frank? I was wondering if anyone that's in attendance today would like the pre-recorded training that you did. Maybe they can go ahead and put their email in the
I
chat, and then
I
Yeah.
think
that
pretty
way
much everyone on here, maybe minus one or two, are on my team.
on your team. Okay.
Yeah, so even if you send me that, that'll be helpful too.
Oh yeah.
Okay.
So we can get
Yeah.
started with that process. But yeah.
Yeah, that way you're not delayed in at least like
Mm-hmm.
attempting it, and then still don't hesitate to submit a ticket. And then Frank's really responsive. Like if you
Mm-hmm.
even want to meet with him next week, he'll
Yeah,
definitely
yeah,
schedule
because I see
time.
some of my staff putting the information in the chat now, which is absolutely fine. I just
Okay.
want to make sure that because we do have some clients that are in crisis that need assistance, and I know like they help with the move-in fees, but
Right.
that Hopper page is keeps getting a pushback. So I just
Yeah.
want everybody to be on the same page with that.
Awesome.
Okay.
Yeah, well,
Thank you so
Frank,
much.
yeah, we'll send that out, Frank, if you don't mind,
Mhm.
to
Yeah.
Demetria, to Jaquel, to Aubrey, to Shava, and we can and then, obviously we can set up additional training as needed.
Yeah. Thank you.
Yeah.
Yeah. No problem. Does anyone else have any other questions?
We do this training once a quarter with Cesar and Aziza and the QM team. If you, like, for example, Jaquel, if you want to set up a training outside of that, specifically for the Hopwell income worksheet, or even like troubleshooting like specific apps that your team is having trouble with, we're more than happy to do, a training just for Christian Community Health Center, or also just on the Hopwell income worksheet. So please don't hesitate
Okay.
to reach out.
Yes, I'm looking at the support screen now so I can try to set that up as soon as possible.
Awesome. Perfect.
Yeah, I think someone has a question about labs.
Oh yeah, let me take a look here. Yeah, Demetria, did you want to go ahead and come off mute, or you can type it in the chat, whatever is easier for you. Labs can while you're go
Can you
ahead.
hear me? I'm sorry.
You- No
So,
worries.
No, it's okay.
so for one of my EFA applications for one of my clients, the labs were submitted back to me because, well, the applications were sent back because the labs, I guess, that I submitted was not efficient for what was needed. Now, I got the actual report back I mean, from the client that I submitted to the what was needed, but I think what was needed is the actual application for what I guess, well, the form that the doctor needs to fill out. Is that really needed instead of the actual labs of what my client gave me?
Well, the labs have to have a detectable viral load.
So
So
the
if it
labs
has,
have it on the detectable viral load is on the labs, but that's what I submitted. And I think it's because it didn't have the actual doctor's signature. Maybe is that why it was sent back?
if it says undetectable, then that would be why it would be pushed back, unless it was unless it was under 20 copies. So it has to have the documentation needs to say, if it says undetectable, then we would need a letter or some type of medical eligibility form stating the positive status.
Okay, I'm going to resubmit them again,
Yeah,
and
yeah.
then I'll see if they get pushed back. My client
Or
is
send me a
coming into.
ticket and I'll take a look at them really
Okay,
quick.
okay, I can do that too.
Yeah.
Yeah,
Okay.
the labs create a lot of confusion because oftentimes our clients have been undetectable so long that it's almost hard to get a hold of the original labs that show proof of HIV. And in that case, oftentimes you can submit an affidavit saying from a provider that says this client is under my care for HIV or AIDS or has been for this amount of time, because we realize sometimes the labs are a bit convoluted, or just don't show the HIV status, originally being positive or over 20 copies. So just connect with
Yeah.
Frank if you're confused around that, but hopefully that helps with that. And then obviously for any clients that are applying for our PrEP applications, they would need to show prescription for PrEP. That application process is currently closed, but hopefully will reopen soon. So hopefully that clears things up a little bit.
And Josh, I put a link for the training video
Oh,
here in the
awesome.
chat.
Perfect. That way, yeah, people don't have to wait for the email. They can just access this meeting chat. So hopefully people can access that. Awesome. Any other questions? I realize we're coming up on almost 11 o'clock. But we're happy to answer any additional questions. Thank you all so much. We realize you're really busy. We also realize it can be really confusing and challenging sometimes to fill out an EFA application, especially the first couple times. Once you get in the rhythm of knowing how to do that HOPWA income worksheet or turning in the labs, it gets a little bit clearer. But thank you so much for taking time to join us today. The video is in the chat if you need immediate assistance with the HOPWA income worksheet. Otherwise, feel free to submit a ticket, and Frank and I are happy to set up a training with your team. If you have any specifics for Cesar, you can also submit a ticket to the quality management team, and they can take a look at some of the technical issues you might be having with CaseWorthy. So thanks again for joining us today. Cesar, did you want to add anything before we wrap up?
No, that'll be all. Just again, if anybody has any questions, feel free to submit a CaseWorthy ticket. I'm more than happy to help you out. And then thank you both, Josh and Frank. I appreciate it.
Yeah,
Anytime.
thank you. Thanks,
Thank you
everybody.
as
Have
well.
a great
Thank you,
Wednesday.
everyone. Have a good day.
Bye, everyone.